What's up, guys? It's Dr. Tim Jackson with another episode of the Boss Body Podcast. Oral health, jaw alignment, dentition, mercury fillings, jaw cavitations. I brought in a subject matter expert, a biological dentist who's also well-versed in airway health.
While I make every effort to broadcast correct information, I'm also still learning. I will double check all my facts, but realize that healthcare is a constantly changing science and art. One doctor or healthcare provider may have a different way of doing things from another. I welcome any comments, suggestions, or correction of errors. I take no money from supplement or device companies. By listening to this podcast or reading this blog, you agree not to use this podcast or blog as medical advice or to treat any medical condition in either yourself or others, including but not limited to patients that you are treating. Consult your healthcare provider for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast or the website. Under no circumstances shall any guests or contributors to the podcast or blog or any employees, associates, or affiliates of the Boss Body Podcast be responsible for damages arising from use of the podcast or the blog. This blog or podcast should not be used in any legal capacity whatsoever, including but not limited to establishing the standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast or the blog.
Welcome to the show, Dr. Daylis De Andrade.
Thank you for having me.
Absolutely. So we had your husband on a few weeks ago, and we talked about some of the stuff that you guys do at your clinic. And we talked about, the importance of the oral systemic connection. And one thing that kept coming up was upper airway resistance syndrome or sleep disordered breathing. And I don't think a lot of people understand the risk it puts you at for heart attacks, strokes, low libido. Talk about some of the things that it affects.
So, as you're saying, the reason also that I got into holistic dentistry is because there's a big disconnection between, the teeth or the head and the rest of the body and how that affects everything. So, you mentioned metal toxicities, right? Like amalgam. And the thing about that is, even back in the days, the government used to say that it was safe for us to use. And actually a recent article published by them is actually saying that it's not safe to use. And they list a bunch of people that it's not safe for, not only, pregnant women and children, but also people with neurological disorders, MS, and also other disorders. And they also stated that actually mercury vapor does escape through the mercury fillings over time, which is a big thing because you would talk to any dentist, a few years back, and they would tell you that that's not true. But there's also a lot of research backing that that mercury fillings does cause toxicities, does cause problems with MS or other, autoimmune diseases. So it's really sad that, we can't see the body as a whole, and anything you do in the mouth also has an effect on the rest of the body.
Absolutely.
Yeah.
And in terms of sleep disordered breathing, what are some of the conditions that it puts you at risk for? Is it just heart attacks and strokes, or what else is involved?
So there's just so many things that is affected by a person that has sleep apnea. Not even adult, also children have sleep apnea nowadays. It can cause bedwetting. It can cause ADHD. It can cause heart disease. It can cause strokes. It can cause, like, the list is endless, because the thing is, when you have a sleep related disorder, you're not taking enough oxygen into your body, right? So when that happens, you pretty much put at risk a lot of organs or systems in the body. So it's and the thing is, the reason that is also, to give a little background on that, is because the way that we developed, for example, is very different than our ancestors. So back in the days, we used to be chewing on big chunks of meat, big chunks of foods, and we used to work our teeth a lot. Nowadays, most of us, or even me, I had a problem breastfeeding, for example, and breastfeeding is a big thing for jaw development and also, you know, the healthy development of the child. So with that being said, a lot of kids nowadays are not being breastfed, one, and two, the way that they're processing the foods is very pureed, very, you know, things that really don't stimulate the jaw muscles. And that causes a constriction in the jaw. And when that happens, then the person for the rest of their life has a, you know, sleep related issues, which I see a lot in my clinic actually. And there's ways that you can also diagnose that in children and adults. For example, you see a lot of patients walking in with like very constricted jaws. Doesn't really have to do with obesity, because most people think that sleep related issues is due to obesity, which yes, it is, but there's really fit, you know, even men, women that I see here that have a sleep condition because of their jaw development. So they have very constricted jaws. You can see that in a patient also when they have a lot of wear in their teeth. You can see it with patients that have a lot of recession or have fractions in their teeth, which is when between the crown of the tooth and the root, that area in the middle starts wearing off a lot. You also see it in patients, for example, that have really big tongues, which in reality is not that they have a big tongue, is that they have a small housing for that tongue. So, I mean, I can just go on and on talking about sleep issues and why it affects the rest of the body. But I mean, concentration is a big thing, which affects a lot of the population nowadays. As you know, we have a lot of people now on concentration medications because they can't concentrate.
Right. Yeah.
I
And
don't know how
there's,
it's insane.
I know, and something you touched on, the whole idea of centric relations, you
Mhm.
know, which is why I had my jaw surgery back in the day, 20 years ago, and they brought my mandible up and back, which was the opposite of, you
What
know,
you could do, you should always
yeah,
not constrictive. But even orthodontics back then, and still some ortho practices still take out, for example, premolars. Just because you take out premolars, you can put everything, I guess, shift everything back into place. But what you're actually doing is constricting the patient. And you also see that with bilateral premolar extractions, either upper and lower. A lot of those patients as adults, now they have a sleep issue, because what happens is you remove teeth that are healthy that didn't need to be removed, and now the patient is more constricted. And that also causes sleep apnea and sleep related issues.
right. And along those same lines, I use nasal mutes to keep my
Yeah.
nasal passages patent. You know, I'm glad people are paying more attention to breathing, but the mouth taping, you know, I talked about this with Dr. D. If you go straight to the mouth taping and you don't have nasal patency, you know, that could be a thing, right?
Yeah. And there's other therapies too that you can do. There's myofunctional therapy where you learn to put your tongue at the right place. You can also do some patients have a tongue tie. You can release that tongue tie. But you shouldn't really release the tongue tie until you have a treatment plan to kind of fix that constricted jaw. Because if you sometimes do a tongue tie without really fixing the jaw issue, then you can cause even more issues. So you have to be very careful of how you treat that and the steps on which you treat that.
Yeah, absolutely. And in terms of tongue ties, I have a tongue tie. I haven't had it released yet. I've gotten mixed opinions amongst holistic dentists. Some say if you have a small airway, and even if you do myofunctional therapy, if you release the tongue tie, that's going to end badly. But then other people say you got to release it. So, what say you?
Yeah, I mean, it really depends on the specific case. But for example, we do a lot of sleep apnea in our practice, and we use a company called Vivos. And we kind of pack everything together so we don't have failures in terms of when we do have to do a tongue tie, we don't run into problems. Because when you do a tongue tie, you should really do myofunctional therapy, because that also trains the tongue how to sit in the proper place, trains you how to train your tongue to do what it's supposed to. So it's kind of like quarterbacking everything. So it's not a one thing fixes everything. You really have to
Right.
do modalities,
Yeah.
expansion, therapy, tongue release. There's photonolasers that are great also, as we mentioned. You can do that on the tongue, you can do that on the tonsils. There's many things that you can put for you not to have a failed, treatment per se.
Right, absolutely. And the sleep disordered breathing stuff. So in order to get my appliance that I have now, that took most of my sleep apnea away, in order to get it covered by insurance, I had to go see a pulmonologist first, right? And so he's like, well, you're snoring, but you don't have apnea. I'm like, I had 23 hypoxic events per hour. He's like, okay, well, I'll give you a CPAP. I'm like, no, I'm not doing the CPAP. I'm not doing this with you. Like, just give me the referral to the airway centric dentist and call it a day. Like, they want to be the gatekeepers for everything, which I mean, I can understand some of the defensiveness, but when you're putting people's lives at risk for heart attacks and strokes, just to boost your own ego, that's pretty bad. But with the sleep disordered breathing stuff, there's a book was up here. Oh, it's right here. 6 foot tiger, 3 foot cage.
I love that. Yeah.
Have you heard of it?
Yeah. Yeah. Yeah.
Yeah. And so, there's a diagram in there, and he's like, until you fix your sleep disordered breathing, it's like pushing everything in life is like pushing a boulder uphill.
Yeah. And that's correct. Like, I mean, we mentioned earlier, it causes a bunch of other problems. It causes sexual problems, heart disease, depression, dementia. I mean, you name it. Kidney disease,
Right.
bone loss. There's just, I mean, I think sleep apnea literally affects pretty much everything in your body because your body depends on breathing. So if you're not breathing enough oxygen, then everything else is kind of, slowing down. So
Right.
it's a good thing. I think 1 in 10 Americans suffer from sleep apnea. That's a big
Yeah.
number. And I think that's only gonna get worse and worse,
Yeah. And like you said, I mean, back in the day, I used to think that, oh, yeah, if you're overweight or obese, then you can have sleep apnea, but skinny people don't. But I'm not skinny, but I work out. I'm muscular, stocky. I work out 4 to 5 days a week. And sometimes that can exacerbate issues. Obviously, you make your neck a little bit thicker with the upper traps and things. But have you seen any issues with people on testosterone replacement therapy and that exacerbating sleep disorder breathing?
So I think to say testosterone is causes more sleep apnea is wrong per se. I think is one is dosing and one's the provider that you're seeing. So if you're doing like street testosterone where you just, have somebody that's just a trainer kind of give you steroids, then I think you shouldn't do that. I think that will really mess up in terms of anything sleep related. I think if testosterone therapy is done the right way and the way that your body can handle it with the right dosage, there's really no problem with that. It just has to be done correctly.
Right.
Yeah.
Absolutely.
Done wrong,
So,
it next like not healthy.
right. Where along your dental education did you start to realize, okay, there's this disconnect between conventional dentistry and holistic dentistry?
So, I met my husband. We're going on 9 years in December, and he's always been kind of a outside the box thinker. He's, very always alternative mindset, more holistic mindset. And when we started dating, he really showed me kind of like another medical view that I had never heard before. So I was kind of like blown away. And um we figured I'm like, if there's this thing for medical, there has to be a more safer, more holistic side of dentistry. And I just had, started digging and I saw that there was organizations for this and I pretty much joined all of them. I'm not even a part of, I don't even renew my ADA membership anymore because I think the information that they have is very outdated. And I'm pretty much associated with every holistic, association out there. And it just makes sense to me. It makes sense. The less toxins you put in your body, the more healthier the patient will be. And I think it's one of those things that once you see it and once you have, I think when you're ready to see it, it just shows up and there's just no way to unsee it.
Right.
I just
Absolutely.
practicing another way. And
And so,
I mean, I still get into arguments with dentists about fluoride. which is to me is nonsense because there's
Yeah.
just so much research out there about fluoride, about root canals,
Yeah.
about mercury toxicity, and it's just how long would it take for them to find out well, that the truth is there? It's been sitting there for years.
Yeah, if you go to PubMed and type in fluoride and, central nervous system or brain health, I mean, the main study out of Harvard shows it lowers IQ, not to mention, it's a goitrogen, so it blocks thyroid function, and which is going to decrease every other function in your body. So you were already out of dental school when you started looking into holistic dentistry.
Yeah, I mean, I practice uh general dentistry for a few years. And then I just like I said, I started going to these conferences, reading the books, for example, Weston Price, which is I guess the father, you would say, of holistic dentistry. He actually invented vitamin K2, which most people don't know about. He's written extensive work on root canals and focal infections in root canals and how it can affect the rest of the body. He's even implanted extracted root canal treated teeth on animals, and they actually present with the same symptoms that the patient had. So, and he's done that on he has done that on a bunch of teeth. So the
Yeah.
research is out there, the information is there, his books are there, but for some reason people don't want to hear it.
I imagine it would be really difficult to go through dental school or any healthcare professional school if you already know this stuff because it's going to be fighting a battle.
Yeah, my assistant actually, she wants to be a dentist, and she knows the correct way to do dentistry now, and we always talk about it. It's gonna suck for you to have to sit there and put fluoride on people's teeth and even do amalgams on people and root canals.
Right.
It's hard to get away from that if you want your license, but yeah, I would hate to go through dental school again, knowing what I know now.
Yeah. And does the professional regulatory bodies, do they give holistic dentists like yourself a hard time?
So definitely, I mean, not, and I wouldn't say the ADA or anything like that, because back in the days it used to be like a big thing. I think now there's more of us, and more of us I think is only like 250 in the US, so it's not a lot of us, but back then it was a big thing. A lot of people lost their license because, for example, you can say that you could say you want to remove mercury fillings for cosmetic reasons but not for
Yeah,
health reasons.
that's what I was gonna
So
say.
what? You can
Right.
remove it for cosmetic reasons, but not for health reasons. So back in the days, there was a fine line. Today, there's a lot more patients looking for this kind of dentistry, so you don't have to be kind of like so guarded.
Right.
But it's more, I wouldn't even say the organizations itself. I would say more of other general dentists. Even some of my friends are like, okay, I think you're doing something right, my dental friends. And some other ones are like, are you crazy? Like, what are you doing? Like, and I have to sit there, and sometimes they're like, oh, hormones have nothing to do with your teeth. And I'm like, there's research out there, look at it. And then I send them a bunch of research and they don't even look at it. So it's like
Yeah.
I even stopped trying to rationalize with them. So I don't even send them articles. I'm like, the information is out there. If you want to look at it, look at it. If not, don't look at it.
Exactly. Exactly. And one thing that's an interest of mine is jaw capitations.
Mhm.
So in the other room, I have a lumen photon machine that actually has a Nico setting on it, and you just strap it around your jaw. And there was a guy, he's in North Carolina, but he has the cavitat machine. And he had, I wouldn't have believed it if he didn't have the machine. He would go from North Carolina to South Carolina and he would go to different dental clinics taking the images. And he found before, or he took before and afters, people using the lumen photon. And not all, obviously, but many people were able to get rid of their cavitations with lumen photon. I know ozone can also be helpful. And then I've had a few patients and clients who they have jaw cavitations, they have the surgery, and it kind of knocks them on their butt. And then oftentimes the cavitations return. Do you have any
Mhm.
thoughts on that?
So yes, you can treat cavitations there's different modalities. You mentioned, you know, there's, for example, lasers that you can use. A lot of us are using lasers for cavitations. Some of us are using just going in there and you know, scraping everything out and cleaning everything. Ozone gas, ozone water is very good at disinfecting. We also have now the PRP injections, which are also very helpful. So those are really good ways to treat cavitations. Also to diagnose them, CBCTs are great at diagnosing infections, cavitations. For the most part, sometimes cavitations might be there and they might not show up in the x-rays. It's kind of like saying some root canals, you can clearly see that there's an infection on a CBCT, but sometimes it doesn't show any infection, but there's still bacteria present. But yeah, there's many ways to treat cavitations. And again, it's more on the holistic side that the treat the cavitation. General dentists are really not paying attention to that. I would say that most general dentists are not even doing CBCTs or standard of care, which is insanely crazy to me because here in my practice, pretty much we do CBCTs on every new patient, unless really the patient doesn't want to get it because, you know, X reason. But you can find so many infections with a CBCT that you cannot find with a traditional 2D X-ray that it's just mind blowing that it's not a standard of care in dentistry when radiation is so minimum.
Right.
But yeah,
Yeah, and in terms of cavitations, one thing that comes to mind is when wisdom teeth are removed. You know, back in the day when I thought, oh well, you know, the doctor said it, so it has to be true. I got talked into having my wisdom teeth removed and the other jaw surgery, but I got a dry socket. But my question is, why do they teach dentists to leave part of the periodontal ligament intact?
so I think it's not so much that they tell us to leave it intact, but it's one of those things where they kind of just teach you to take out the tooth, and they don't really focus on why we're taking out the tooth, for example, especially for infected teeth. So it's very little training also that we get in dental school. For example, in Nova, it's a great school. I would do dentistry again in Nova. I loved it, but I feel like most dental schools now, for some reason, they give you very little hands-on experience. So for example, to do an extraction in dental school, I had to do a rotation, and sometimes we only had 4 rotations in oral surgery a year. And sometimes there were teeth to extract, and other times there wasn't any teeth to extract. So I think the training that we get is very minimum. And if you really want to be, you know, one of the top dentists, you really have to do, you know, extra training, whether it is in oral surgery or any other surgery. But you are right. They don't stress enough the importance of removing dead periodontal ligament. And to
Right.
add on to, I think that is the hardest part about taking out the teeth, because sometimes we take out the teeth really quick. But what really goes down is really getting in there and removing that, you know, dead periodontal ligament, because it's very gooey in there and you really have to scrape it manually. And if you don't, that's where you have cavitations and you have those issues happening. Sometimes they go unnoticed for a long time. And it really depends on the immune system of the patient, also how they react to it. But any cavitation in the body is bad, you know.
Right. Absolutely. Basically poisoning yourself from within constantly, correct?
That's just
Yeah.
localized, you know, localized and focal chronic infection over a long time that can really affect any organ or any, you know, any part of your body.
Right. Absolutely. And you mentioned hormones and teeth. So obviously we know the body can be in a catabolic state where you're breaking down tissue, homeostasis, or anabolic state. And if we're in a catabolic state, so too much cortisol, not enough anabolic hormones, then I'm guessing, I don't, you correct me if I'm wrong, that your oral health would go down.
Yeah, 100%. Any stress in the body can cause inflammation in the body, and it can also cause inflammation in the gums. And we see that a lot when hormones are, you know, not balanced, right? And a lot of people have hormone imbalances nowadays. I would say most people have a hormone imbalance nowadays, women and men, unfortunately. But that affects
Yeah.
all oral.
Your husband, Dr. D, he gave the example of, you know, a guy comes in, he, you know, has trouble gaining muscle and he's drinking protein shakes. It has red 40 and all these endocrine disruptors. I mean, when I talk to guys at my gym, about like, because they're like, oh, what gear are you on? I'm like, nothing. And they're like, no, like, just be honest. I'm like, okay, follow me around for a day or two, and you'll see that I'm telling the truth. Like, digest your food. Like, half the power lifters in the gym, I'm just like, you need to take a huge poop. It looks like you've not pooped in like 2 months.
Yeah.
And I know that's graphic, but if you're not digesting and assimilating your food, then what's the point of eating all that protein?
Yeah, makes no sense. And most protein shakes have bad chemicals in it. I think there's only one. I think there's somebody's looking for uh protein that's clean. Empty Capra is just pure 100% goat milk. It doesn't taste like all those protein things
It's
that
called
people.
empty what?
Empty Capra. It's
Empty
a goat
captain?
Capra, CAPRA.
Oh, okay, gotcha.
That's one
Gotcha.
of the cleanest one. It just has goat protein. It's one of the safer ones, but like I said, I think chewing your food and getting good sources of protein from grass-fed and grass-finished meats is the way to go. 100%.
Absolutely. Do you guys, so if someone comes in and they need a dental procedure done, whatever that procedure may be, do you guys do things like IV vitamin C to help them expedite healing?
Yeah, so we do high vitamin C for healing. We also have the hyperbaric oxygen machine, which is really, really good for actually cavitations, any infections. So a lot of patients do the IV vitamin C, but they do the high vitamin C, but they also do hyperbaric therapies, which is great. You can actually have a patient that has osteonecrosis in the jaw, and most of the times you can't do a dental procedure on somebody who has a osteonecrosis of the jaw, but if they go through a specific series of treatments with the hyperbaric, we can actually work on them. That's how powerful the hyperbaric machine is. I think
Yeah,
tools that we have for sure. It's good for cavitations, for post operative, extraction before and after actually. It,
right.
it really helps with the outcome of the surgery. And it's great because since we have the medical side, we have all those tools. We have the infrared bed light therapy, which is also really good for infections. So it's just like an add-on. So we're
Yeah,
lucky.
absolutely. And in terms of the oral microbiome, so most people know about the gut microbiome, but this first came on my radar about 9 or 10 years ago. And I was in like a Facebook functional medicine study group. And we were talking about Prevotella and Fusobacterium. And so I used the GI map test and sometimes BiomeFX and a few others. But this biological dentist, I think he's in Missouri, he said that if you see Prevotella and Fusobacteria elevated, you need to send them to the biological dentist. And so far, I'm like 10 out of 10 on finding it.
Yeah. We offer that also in our clinic, microbiome, I would call it DNA testing. And it actually, we usually do it before somebody gets a cleaning with us because they'll tell us, the higher rates of bacteria that puts you at higher risk for heart disease, for strokes, for all of those diseases. And once we have a baseline of what you have, we can give you a treatment plan to reduce that. And for example, you can reduce that with we do all of our cleanings here with ozone water. We also use PRP injections for like deep pockets. There's oxygen drops that you can use on your on the mouth to decrease the load of bacteria. You can use ozone oils, also decrease that. You can use digestive enzymes, binders like charcoal to remove those kind of bacterias. So there's different modalities that you can use. And it also helps that we have the medical side because once you have that backing you up, and you have a patient who's hormonally balanced, whose vitamin levels are corrected, and who can get like peptides, for example, for bacteria, that just adds on to our treatment. So I think
Like
we have,
LL37.
yeah, we have the thymosin too, which is really good at fighting any bacteria in the body or any
Yeah,
infection.
that's good stuff. We talked about the trim trial. Your husband loves that trial, by the way. I've heard him mention it like 1,000 times, but it's extremely important because the thymus gland, people know that it shrinks or involutes as we age. High cortisol and stress can cause the same thing. And I told him I have a a notebook somewhere. It's an A4M conference notebook, and it shows the thymus gland before growth hormone treatment, and then I think 10 months later, and it doubled in size.
Yeah.
And so I think that's awesome. But in terms of the oral microbiome, so the gut microbiome is mostly anaerobic, 98% anaerobic. The oral microbiome is mostly aerobic. Are there oral probiotics or prebiotics that you recommend?
So we do recommend some. They're more on the oral. It kind of puts the mouth also more basic, which is another big thing because a lot of us have acidic mouths, and that's a big problem because the bacteria love acid, and bacteria also produce acid. So the more acidic your mouth is, the worse it is for you for yourself. So we also have products and mouthwashes that we recommend that will put your mouth more basic per se. And that also promotes a more healthy oral microbiome. That you got to keep your mouth basic when it's not basic, whether it's the food that we're eating or the drinks that we're having. That's when, people think it's just sugar that causes cavities. No, it's sugar and acid. So if you have a sugar and an acid problem, then that's where you have a problem.
Right. And can you
Fluoride.
share the commercial names for some of the
So
um
some of them, Elementa has really good toothpaste and also mouthwashes. And I'm drawing a blank right now on the other one. I think it's called I would have to get back to you. I'm like drawing a blank right now.
yeah,
But
no problem.
Elementa is really good.
Yeah.
Then there's also digestive enzymes that we can also prescribe the patient through the medical side that really helps in all of that. But the name of the game is just keeping a basic pH in the mouth because once
So
that's
it goes back to changing the terrain.
yeah, and it's like people fight all the time with me for fluoride, and I'm like, there's no evidence that shows that the more fluoride you put on a patient, the less cavities that you have. Because in fact, ever since we introduced fluoride into our drinking water, into toothpastes, rate decay has even increased even more. So it's not a lack of fluoride that causes cavity. It's actually a lack in your diet and a lack in something that your body is missing that is not it's allowing cavities to enter teeth, you know.
Absolutely. And the digestive enzymes, do you have them chew the digestive enzymes or just take them with meals, or how do you guys use them?
We have them take them with meals. Yeah.
Okay,
That's
gotcha.
also disrupt in the gut microbiome can also disrupt the oral. So
Right.
it's almost like it's hard to treat one thing. You have to treat the whole body. It's not a one fix.
Wait, you mean you can't just isolate parts of the body? I thought your heart would beat and then it would stop, then your neurons would fire, and it doesn't work that way.
Like that.
I'm gonna need a minute to wrap my mind around this.
And talking about that, actually, we have because we mentioned the DNA testing that we can do on the mouth, but there's actually DNA testing that you can do on a root canal treated tooth. I don't know if you're familiar with that.
DNA connections.
DNA connections, yeah. I love that lab because you can really show the patient, hey, this is what you had in your mouth. And 100% of the times that we sent over root canal treated teeth, whether it appears on the regular x-ray or on the CBCT, they always come back with infections. As a matter of fact, we did actually a patient of ours that we have in common, which is also a friend of ours. And she had, I believe, 5 root canals in totals. And she was having blood work done in the medical side in biohacks. And she always got back with inflammation. And we're like, my husband was like, why do you keep having inflammation if like your hormones are balanced, everything's perfect, we're giving you all the right stuff, like what's going on? And then he's like, you know what? Do you have any root canals? And she said, yes. So he sent her over. We did a CBCT and clinically infection she had. So she had 5 root canals, 4 of them had big infections. And then we actually sent those root canals to be tested in DNA connections. And when we got back the results, we're like, this is what's happening. So she had a bunch of bacteria in there, but not only bacteria, she also had a parasite. So that's not the only, bacteria is not the only thing that you can have in infected root canals. You can also have parasites, for example. So
Wow.
it attracts so many bad bacteria, bugs, parasites. It's just mind-blowing. It's just, you have a focal chronic infection there for years, you don't even know. And it also can even cause miscarriages. There's bacteria in there that causes miscarriages. And a lot of women have root canals and that I've tested and have this bacteria in it. So
Yeah,
it just shows you that, everything is really connected. And it's not to say, okay, 100% you had a miscarriage because of a root
right.
canal. At least you'll have a less higher chance of having another miscarriages. So I always say, I can tell you 100% that, this won't cause you cancer, this won't cause you to have a miscarriage, but I could guarantee you that whatever is cooking in there, it's not going to be because of your tooth. So the less infection in the body, the best. There's no minimum amount of, bacteria or infection that is healthy. I get that question asked all the time. Like they tell me, oh, the infection, is it really that big? And I'm like, well, it's an infection, period. You need to take it
Yeah,
out and do something about it because it's infection is bad in the body, whether little or big.
absolutely. Are you
Um,
familiar with the Bale-Donine method?
No.
I have their notebook somewhere around here. Um, it's BALE and then DONEEN. A colleague of mine who's a DO in Atlanta turned me on to them. And I haven't done the certification yet, but their tagline is heart attacks are optional. And basically they look at, not just airway health, but oral infections. And my colleague in Atlanta, she told me a case study of a patient who had really high CRP and elevated cholesterol, despite working out, doing the right diet and supplements. And she sent her to a biological dentist, and she had some, I don't know if it was cavitations or at least bad bacteria in the gums. And that was causing systemic inflammation, and that's what drove up cholesterol.
100%. 100%. And a lot of bacteria that's bad bacteria in the mouth is also in the heart. And it just means to kind of show you that if you have something going on in the mouth, you got to fix it because it also affects, your heart or other organs in the body.
Right.
Um, so 100%, any infection in the body is bad to have.
Absolutely. And what would you say, like, the most interesting turnaround you've had in a patient, like who was very unwell, who started thriving after your care?
So it's different because every patient reacts differently, and it also depends on the patient's immune system. But for example, we took out a root canal. It was a posterior tooth on a patient, and then he came back on the follow-up and he's like, it's pretty crazy what I'm going to tell you, but he's like, I was on Adderall for a long time, Adderall. And he says, as soon as you removed the root canal, I felt immediately better. And he's like, I walked out and I just didn't need my Adderall anymore.
That's
So
awesome.
every patient is different. And every patient reacts differently. So it really just depends on the patient's immune system. But I had another patient, for example, I took out, it didn't have a root canal, but I think he had a partial, it's called a pulpectomy, where they remove the nerve when somebody is young and they just leave it without doing a root canal. And he got back and he had like, I want to say like the full page. I did a report on the tooth and it had like, I don't know, 30 bacteria in there. And he
Wow.
had a lot of heart issues, so high blood pressure and all of that. And he says, ever since I removed it, I have my blood pressure is kind of regulated again. So you see
Wow.
a lot of that also in patients. Some patients, I remove it and they have a ton of infection. They can't feel it, but then, for example, their lab results get better, like that friend of mine.
Yeah.
So it just varies.
Right. Absolutely. But, it's not going to be healthy to leave it in long term. So you need to get it out regardless.
100%. And also the thing is with cavitations or infected root canals is that, there's really no blood supply or lymph supply in that area. So because there's no blood supply, you can't really clean it. So
Right.
if you don't clean it, it just stays stagnant in there and it can travel to other areas in the body. The whole thing with dead tissue is that there's no blood supply. And that's where the problem is, because even if you're a healthy person, your body really can't fight it because there's no way that it can get to it. And that is the
Right.
whole issue with teeth that need a root canal or that have root canals. They're considered
What
dead organs.
What are your thoughts on, like, the electric flossers that are coming out?
So, like the water picks, you mean?
Well, I have a water pick, but there's one company, I don't remember the name of it off the top of my head, but it's got a piece of floss going from this pole to this pole, and then it's just like you press a button and it goes back and forth.
That's funny. I feel like nowadays they're trying to make like a magic pill or a magic product to
Yeah.
solve problems, and it might help, but I mean, there's nothing better than flossing correctly. And you shouldn't really floss with the same floss on each tooth. You should really roll up the floss. That's why I like the longer floss, even though
Mhm.
it's complicated to floss. I think that's the best thing. So I would stick to regular flossing. The water picks are good, but they really don't take out pieces of bag of food that are stuck in there. It's harder to take those things out. So my recommendation is to just use regular floss.
So
Find one
no
that
floss picks, like the little.
floss picks is you can really damage your gum. So especially patients, you don't really know what they're doing, so they're kind of stabbing themselves. You can cause a lot of issues on the gum area. So I would not use that. I don't even use that, and I know what I'm doing in terms of where I'm
Man,
touching.
I gotta throw out a bag of floss picks. Uh, that's okay.
I don't
So,
think especially don't use the pointy part of the floss.
right.
I mean, it's better
And
than, but ideally you want to use clean floss while you're doing each tooth.
it's kind of hard for me because I have a relatively small oral cavity and I have fat fingers. So the flossing is not an excuse. Yeah. You got any workarounds for people with fat hands?
Well, at that point, I would just say use a little C-shaped floss, but um, as long as you're using something, I think it's a good idea. But I think the more traditional that you can stay in terms of that, it's better. Yeah,
Okay.
yeah. There's a
What's
bunch.
some what's something you know today that you wish you would have known 10, maybe 12 years ago?
So, I mean, I did root canals myself, because I didn't know any better. I removed a lot of mercury, before because I didn't know any better. Um, One thing I used to do too is I used to do bridges. But nowadays I don't think I've done a bridge in a long time. It's just save the money and get an implant, because over the long term you can really damage those teeth. You can put more force on them, and it's not to say that they don't work, but I would just say just save the money a little bit and look for a more long-term solution. And ideally what I would recommend also for implants is our zirconia implant, which they're considered the ceramic ones, and just make sure that they're 100% ceramic, because a lot of companies are coming out with zirconia implants, but for example the internal screw is metal. So just make sure that everything is 100% ceramic, because
And
that the body.
are you able, there used to be the Clifford Dental tissue compatibility test where you could check, the materials against your immune system. But I know he has since passed on, unfortunately. Is there another lab that you can use now?
Yeah, so we usually use Biocomp labs. They'll give you like a 300-page report of what your body is allergic to and what it isn't. But here, for example, in my clinic, we have probably the least toxic materials that we can. So if patients don't want to get the Biocom testing, at least I think they're safer in terms of the things that we're putting on them. I always say the best dentistry is no dentistry, but when you do need it, just make sure you go to a provider that has the least toxic materials or the more biocompatible materials, because that's going to make
Awesome.
a in your overall health.
Right. Well, this has been a wealth of knowledge. And, for the listeners, the clinic that Dr. Daylis and Dr. D have together, it's very unique. Like I was telling your husband, most of the time when I tell patients you need to do this and that, they got to drive to at least another city, but usually another state. So to have, it all in one building is very unique and cuts out a lot of time and wasted resources. So where can people find you?
So we're located in the design district. My office is called Biodent, and my husband's office is called Biohacks. We're actually just thinking of just being Biohacks Dental just to make things easier, but we're located in the design district. Our address is 4141 Northeast 2nd Avenue, and our suite number is 106A. You can also find us on Instagram. You just type in Biodent at Biodent, Biodent, and you can just send us a message or ask us any questions you might have. We'd be happy to answer.
Awesome. Well, thank you so much. And hopefully we can have you back on in the future for some updates.
Thank you so much for having me.
Absolutely. Have a great day.
Take care. Bye.